My name is Sheryl-Seale. I grew up in Victoria. I worked for the last 40 years here in the Lower Mainland. I'm married, have been for 40 years. I started off my career as a legal assistant. I was a senior staffer to Thomas Mulcair. I worked for Caucus, I worked for a couple of MLAs, did all those sort of things. It was on July 17th of 2017. I was having a shower and I discovered a lump in my left breast. I'd never had a lump in my breast before, and it was movable, so I wasn't kind of overly concerned about it. I thought, oh, well, all right, something's going on. But given that I'd never had one before, I'm getting into the doctor as soon as possible. She said to me that she felt it was a cyst, but just to be on the safe side, let's go send you off for a diagnostic mammogram. I noticed that when they were doing the diagnostic, that they were moving around to a couple of different places. I thought, oh, that's kind of interesting, because they did the spot that I knew of, but there were a couple of other spots. She said to me that they saw some concerns, so that they wanted to go and wanted me to do a biopsy. They were supposed to only do two biopsies. They did end up doing 3. And on September 6th, I went in to see my doctor, and she informed me that I had breast cancer. So I wake up, I have my surgery. She felt that they got everything and that I would probably be okay as far as, any further treatment. I went, oh, okay, all right, carry on. The end of November, probably around that time, I get a call in to go and see Dr. Goki again, and she says, well, she said, I think that you made absolutely the right decision. She said, because we not only got that cancer, but there were 3 other very minute pieces in there as well, and she said we would never have seen that otherwise. She said, however, she said, we do want to send you off for some treatment, because we went in and there are 3 sections to your lymph nodes underneath your arm in this area. And she said we went into the first section, and we went into the 3rd section, and we took out 28 lymph nodes. And she said, of those 28 lymph nodes, they found 4 that were diseased. She said, we caught you at the early stages of stage 2, and as if you know anything about this, there's many stages in between stage 2 and stage 3 and all that sort of thing. She sent me off to see a Dr. Caroline Mariano, who sat me down when I went in to see her, explained to me that I was going to have to go through chemotherapy, and that most likely I would have to do some radiation treatment. I'm processing this as she's telling me all of this, and okay, all right, this is what I got to do. So, funnily enough, before I even phoned my husband to tell my husband what was going on, I was on the phone to my hairdresser and a wig shop. That tells you where I was at. So I make a appointment to see Kelly Hellam. She's been going through the same journey, had already been through 3 years into the same journey I was about to go through. She went into learning how to tattoo brows and things like that. She was telling me about her journey as she's doing my brows, right? And she mentions that she wished she had not been taking the anti-nausea drugs like she should have been, and so she had a really horrible time through some of it. I said, well, how did you get better? And she said, well, I happened to run into this naturopath oncologist. I got referred to her. Her name is Dr. Sheryl-Seale. And she said she absolutely saved me, in that I got so much better. I'd already been through a lot of my treatments, but I was still suffering. And so she said, I went to see Dr. Gurm. Dr. Gurm looked at me, my immune system, me as a whole, what I was going through, what she could, what treatments could enhance me getting better. And she said within 3 months of seeing her, 2 to 3 months of seeing her, she said, I would never have known that I'd just been through the horror that I'd been through. Oh, give me her number, please. So then I go in and I see Dr. Gurm. She spent probably about 2.5 hours with me. Absolutely wonderful, and in everything that she said to me regarding what she does, how she does it, her background, her training, what she's done, some of the empirical, studies about different things that she was suggesting for me. Just answered all of my questions without hesitation on any level, and basically said to me, this is up to you. You do what you want to do, but this is what I can offer you. I just said, let's do it, right? I just said, let's do whatever I have to do in order to get myself healthy and stay healthy through this process. So she put me on a whole bunch of different supplements. She did some testing with me to check me out and to make sure that I was, what state I was in health-wise. I was doing hypothermia, and I was put on ascorbic acid, vitamin C intravenous. She kept very close eyes on me to make sure that anything that was going on with me, that she addressed it if I felt it was an issue or a problem, or if I felt I was suffering in any way or I was having trouble managing something. I saw her for 3 times a week through the beginning of December all the way through to the end of March of 2018. Next thing I know, I come down with the flu. Worst thing possible for a cancer chemo patient. It was one of the worst times that I'd gone through. I was sick for 2 weeks. I dragged myself in to see Dr. Gurm. They were astonished that I was getting there, but I was determined to make my treatments because I felt that whatever she was helping me with, she could help me get through this as well. I said to Dr. Mariano and Dr. Gurm, as a matter of fact, that I now understand why people give up, because it was that bad. I had never been through anything like that in my life. But it was because of what I was doing with Dr. Gurm and her taking care of me, my immune system, and looking at everything about me, and she would just adjust things to make sure, to try and help me get through this, that I felt I got through it. I went in to see the people at RCH, Royal Columbian Hospital, and they allowed me to continue on with my treatment, because there's nothing that was going to stop me from going through and continuing on with my course of treatment. I just wanted to get it done. During all of this, believe it or not, I was working full-time. Again, I contribute that to the treatment that I was getting from Dr. Gurm, because she again helped keep me strong enough that I could work. I was doing all the same treatments. It was just the same regime week after week after week. So now I'm into February, I'm onto this paclitaxel. You could lose your fingernails and that sort of thing. Also other side effects to paclitaxel, neuropathy, which could happen in your fingers or your feet. Through the cold laser treatment that Dr. Gurm suggested, I did that 2 or 3 times a week as well. That has slowly, even to this day, gone through my entire foot, and it's just now in the pads of my toes. And I have every faith that that's going to go away. It's just going to take some time. So I go through the 2 months, January or February and into March of the paclitaxel, and on March 15th, I am done my chemo. Done. Considering what I'd been going through, I was thriving. I also consider myself to be very, very lucky. Because when I was at RCH, in that room with other patients who were going through chemotherapy, there were people there fighting for their lives. I wasn't fighting for my life. I had 8 treatments to go through. Some people I know were going through 52 and were still going. People were being wheeled in. I could clearly see they were fighting for their lives. My cancer was gone. But it still made me realize how lucky I was, and how lucky I was to be with someone like Dr. Gurm. I had a great team around me. So as happy as I was, I still had to remember that I was lucky. Now I go back to see Dr. Mariano, and Dr. Mariano says, we think you need to go for radiation. That was the one thing that I really didn't want to do. I was really hesitating about radiation. I don't really know why, but there was just something about it that, maybe things that I'd read over the years or whatever, I just went, I don't want to do radiation. I go back, I go in to see Dr. Gurm, and I said to her, what are your thoughts on this? I said, should I do radiation? She said, without a hesitation, she said yes. She said, Cheryl, this is the type of cancer that you have. She said, this is your one chance. This is it. I went, oh, okay. I guess I'm doing radiation. So, it was just, she's so clear on her knowledge about what's right and what's wrong, and her not wanting to interfere with what's going on. She absolutely said, I fully support you doing this. So I'm now doing 5 weeks, 5 days a week of radiation treatment. The first 4 of those last 8 treatments went fine, and then from the 4th to the 6th treatment, I really started to notice in my skin that things were really changing and dramatically, to the point where imagine a 3rd-degree sunburn that had blistered and had opened up. That's what had happened to me. I went in to see Dr. Gurm, and she was quite frankly horrified by this condition of my skin. Long story short on that one, she has these magnificent things called Medi honey patches. They spread all over my breast and all over that area, like 5 or 6 of them. Within 10 days of having that kind of a treatment with those things on my breast, I was cleared. I was back up. My skin is perfectly normal, perfectly fine. It's a process. I'm going to have my right side done. Some people go, why? Unnecessary surgery? Well, not to me, it's not unnecessary surgery. To me, it's a peace of mind. I want to get rid. It's like when I did my hysterectomy, just get it out, take it away. You can rebuild. The girls will be fine. I'm in really good health to this day. A couple of things that happened since I finished my treatment is Dr. Gurm did a pulse test on me and an organic acid test. One is a blood test where they're checking, because chemotherapy can be really tough on your heart, and so she's checking my heart health. That's the pulse test, and then the next one, the organic acid test. From what I understand, I may be, maybe a little bit wrong on this, but it goes into the cellular structure of your DNA to see if there's anything happening. It goes that far in. When I got the pulse test back, the normal range is there's 3 different ranges. 3.50 to 3.50 is normal. Then it goes up to 10 apparently. I was within that 3.50 range. 2.56 apparently is optimal for my age. I came in at 2.94. She said that we can still get it down to 2.56. Fabulous, doc, no problem. Off we go. So I'm good that way. She said those are amazing results given I'm this close out of being out of my chemo. She said that's really a fabulous thing. Then she goes on to the organic acid test, and she looks at me and she gets this big smile on her face, and she gets very excited, and I'm looking at her and I'm going, oh. She says, I've probably done hundreds of these tests. Yep, probably have. I've probably seen hundreds of results. Yeah. Everybody comes back with something. Okay, all right. She says, you've come back with nothing. She said, I've never seen anybody in all the time I've been doing this come back with nothing. She said, you are my poster child. She said, this is the best news I could ever hope for you. She said, all of your hard work, all of your dedication, everything that you did, you dragging yourself in here when you didn't want to drag yourself in here, all of the work that you did, Sheryl, she said, you proved it can be done, and you've done it. And she said, I couldn't be happier for you. I advocate for this as a part of someone's treatment, not instead of someone's treatment. I would never do that, because that's not what she even explained it to me, that this was it's not as an alternative, it's as part of, to enhance and help your treatments. I feel more confident in my results than I might have otherwise, because once I was finished chemo, it was just like, okay, we'll see you next year. I feel myself, I'm beating this, I'm gonna beat it, and I'm gonna be just fine.